For those of you who I don't know, my name is Mark Sherman. I'm a family doctor and a proud member of this wonderful division. And I'm also executive director of the BC Association for Living Mindfully, which is a fairly new initiative offering mindfulness-based stress management to our patients, and hopefully soon to us as physicians, and we're offering groups to teachers and other members and cohorts in the community. And so today I am going to talk to you about Heal Thyself, mindfulness, meditation, and physician health, which is why we're here. And by the end of the presentation, you'll have seen some cartoons, I'll have read you a poem, and yes, I will have guided you through a meditation. So I get to be the last speaker and get to ease you into a relaxing end of your evening. Oh, there we go. So meditation is everywhere. It was on the cover of Time magazine, and it seems to be, mindfulness and meditation seem to be the buzzword all around us. Our patients are reading about it. There's articles in every journal and in all of the media reports that we're exposed to. Our patients come to us wanting to learn more about this. They want to be on the cutting edge of relaxation. If you Google mindfulness, you get 5 million hits. If you do a PubMed search on mindfulness, you get 2,000 peer-reviewed articles. So this is something that's not just popularized, but it's something that there's a gaining momentum of evidence behind as well. And so we're going to talk a little bit about what this mindfulness and meditation is. So as our patients are becoming very interested, there's also Canadian competitions on meditation, and if you're interested, I can give you more information on that. So I'm going to offer that there is a stress epidemic among us. I don't think I need to convince you of that. I think we're all of the profession that we see this in our day-to-day life and in the work that we do with people we call patients. Arguably, I think as some of these statistics will show, I would offer that it's one of the biggest public health threats that we're facing right now. So depression is the leading cause of disability as measured by years lost to disability, and was the 4th leading cause of global burden of disease in 2000. The World Health Organization estimates that by 2020, depression will be the 2nd largest overall disease burden worldwide, right across the board. It's a growing problem in the workplace. We see that currently over half of all sick days in Canada are due to mental illness. We know that 75% of all short-term and long-term disability claims, I think we know this one, are related to mental health. And mental health problems, I think that this is actually an underestimate. I've seen up to $30 billion annually of what it costs Canadian employers when our patients or ourselves are away due to mental health challenge. And it's a growing problem in healthcare. So 27% of all Canadians have been surveyed as finding their working life as highly stressful. Not stressful, not kind of stressful, highly stressful. 45% of Canadian healthcare workers would use the same label. Apparently, according to Ian, not in Victoria, which is wonderful to hear, but us as healthcare workers, now healthcare workers is across the board. This is anyone from social work to psychologists, specialists, GPs, etc. 58 to 64% of nurses, GPs, specialist physicians would use this description. And be kind to the head nurses and nurse supervisors. 67% of them would describe their working life as highly stressful. The CMA did a Canadian physician health survey in 2003 that was looking at burnout. And burnout was represented. There was mild, moderate, and advanced stages of burnout. And burnout was measured as, irritability, unhealthy use of substances, relationship turmoil, fatigue, malaise, chronic disease challenges, etc. And so I'll just pose the question to the crowd, for those of you who don't know the results of that study, what is the percentage of Canadian physicians in 2003 that were in the advanced stages of burnout? Just yell it out. What was that? 30. It's a lot. Okay. Anyone else? 47%. GPs and specialists across the board. And 17% were in early or moderate stages of burnout. So the study actually estimated, Canadian Medical Association study, that 35% of us manage and navigate our stress well. That's associated with our work. That's just part of what we do. And Helen spoke to this, which I really appreciate, that there's certain unique challenges to the work that we do. And we know these very well. So what leads to stress in our own work? Well, overwork. And I think that as she gave a brilliant example with the sprinter versus the marathon runner, overwork is a very easy temptation in what we do. We get paid for fee for service. There's certainly lots of demand for the work that we do. And so overwork is certainly one of these sources. Boundary issues is a huge source of potential stress for us as family physicians. And we know this because when we look at our day sheets at the beginning of the day, a good sign that you may have slipped on some of your boundary setting with your patients is if you see a name and a chill goes through your spine, perhaps there's some work with the boundaries that you have with that patient. And boundaries don't imply that we don't care about them, that we don't work on that patient-physician relationship. It just implies that we honor ourselves as well as the patient, that sometimes saying no is saying yes to ourselves, saying no to someone else. One of my wonderful teachers, a man named Dr. Stephen Ong, who works in Edmonton, often says that those patients that we look at on our day sheet and we get that chill, he said the reason why they keep on coming back is because we still have something to learn from them. And I love that because now whenever I have those patients myself, obviously, and as I see those names on my day sheet, I'm like, my teacher is here today. Compassion fatigue. There's lots of debate in the literature as to whether this actually exists, but I think that most who have analyzed burnout and compassion fatigue would agree that at some point as human beings that care, and that we've chosen this profession for a reason, that when we're working day in and day out, really wanting to, and perhaps falling into what Helen was talking about, of wanting to fix this person, this problem, this challenge, that we give and we give and we give and we work and we work and we work, and then sometimes we feel like we're becoming more embittered, we're becoming more fatigued, we're having more of those patients on our day sheets that we get the shiver from. I think Chris and Helen beautifully spoke to this, not attending to our own needs. We're brilliant at talking to patients about foundations of health such as diet and stress management and exercise and having good social equity around you and so forth. And yet sometimes, because of the demands of our work and our trying to balance personal and professional life, we let go of these same foundations. Perfectionism. So, not anybody in this room, but it's said that many in the physician and the medical field, we have a hard time. My CBT instructor, Greg Dubord, often talks about lots of studies that have been done on the good enough philosophy. That we suffer less, we have less incidence of depression and burnout when we allow ourselves to be good enough. Now, can we be a good enough physician? Right? What would the public think of us if we were every day aiming to be a good enough physician? And yet, if we don't allow ourselves that latitude, burnout is more likely. So let's shift gears a little bit. So what is mindfulness? So what is this excitement around this label, this title, this philosophy? So we have some definitions: paying attention in a particular way on purpose in the present moment, and here's the crux: non-judgmentally. So yes, it is about just being here and just noticing, and yet it's not jumping into those judgments and discriminations about whatever's happening. One of the definitions that we use in the courses, The Art of Living Mindfully, that we run in the community, is the practice of being fully present with whatever is, right here and right now, with full awareness and without judgment again. So there's informal mindfulness practice. As we said, that's being here now. I'll talk about it in a few slides here, but we've done great research in neurosciences and neuroanatomy showing that with functional MRIs and so forth, that when we have two neural networks that use completely separate parts of the brain, one is called the default or narrative network, and we know this network. This is the network that we tell stories about our experiences. That patient had that expression on their face, this must be what they're thinking, and therefore this is an interpretation of who I am in this way, etc., etc. And we do this, and sometimes we do it in unhealthy ways, like I just exemplified, and sometimes we do it in order to plan our vacation, or in order to plan or figure something else out. So the default network is not a bad thing, but it's the place that we're in a lot in our brains. The other neural network is called the direct experience network, and this is what mindfulness is about. It's you're sitting on a dock and you're just aware of the wind as it dances across the water. You're just aware of the bird song, not interpreting it as that must be a yellow-speared robin. It's just noticing the song, noticing the sun as it dances with the trees. That is the direct experience, and the research seems to show, and there's lots of it, that the more time that we spend there, the less we suffer, the better we navigate stress in our lives. And it's a skill. It's a skill. We learn to use that network more. Buddha's two arrows. So in Buddhism, there's a wonderful teaching that we often use in our course that talks about the two arrows that cause suffering in our life. The first arrow we are more than intimate with in the work that we do. That's the arrow that life shoots at us. It's old age, it's sickness, it's pain, it's loss. We know this arrow, and no one escapes this arrow. Everyone in this room has known this arrow, directly or through people we love and know. The Buddha taught that that causes a measure of suffering. The second arrow is the arrow that we shoot at ourselves. The judgments, the discrimination, the attachments that can lead to us suffering in ways that we didn't need to. And people who struggle with anxiety know these second arrows well. There might have been a little sensation in their heart, or somebody said something. But what their mind has a tendency to do is add layers of fears and past experiences to that, and such it becomes anxiety or panic. And there's formal meditation practice. So just a show of hands, who's experimented with or has a regular practice in meditation or mindfulness? So if you just look around you, our colleagues are already engaged in this personal practice. And how does that affect, and this would be a conversation unto its own, how does that affect their practice and how we interact with our patients? So examples of formal mindfulness practice would be mindfulness meditation, which we'll do a little bit of an experiment tonight. Walking meditation, and metta or loving kindness meditation. So these are examples of tools that we use in some of the courses that we teach that are experiential. That yes, it's about the theory and what is mindfulness and being inspired by books or workshops or lectures or what have you. But as a famous yoga teacher, Pattabhi Jois once said, it's 1% theory and 99% practice. So what we encourage our patients and participants in these courses to do is to practice, because what they learn and what they grow from comes from that practice. So what is meditation? Well, it's a practice of concentrated focus upon a sound, object, visualization, the breath, which is what we usually teach, movement, or attention itself, in order to increase the awareness of the present moment, reduce stress, promote relaxation, and enhance personal and spiritual growth. This is the fun stuff. What is the evidence for mindfulness? Improved memory capacity and hippocampal size and activity, shift from a left to a right brain focus, and therefore less tendency to rumination and over-intellectualization, improved parasympathetic stimulation. We talked about this. So a greater skill in utilizing that other neural network of that direct experience. Depression, anxiety has enormous, really exciting research behind it in mindfulness-based strategies. There is, and we know, I think we've heard of these terms before, there's mindfulness-based stress reduction, there's mindfulness-based cognitive therapy, there's mindfulness-based relapse prevention, there's dialectical behavioral therapy, there's action and commitment therapy. All of these are mindfulness-based therapies that have their own literatures showing efficacy, particularly with mood disorders. So we're pretty darn sure that it works for this. But there's also evidence demonstrating the benefits of MBSR, mindfulness-based stress reduction, in insomnia, showing as good as pharmacotherapy in one study. Addictions, mindfulness-based relapse therapy has been amazing in its research showing prevention of relapse. Cancer and quality of life in people living with cancer. Chronic pain, and chronic pain they've done studies on a variety of conditions, and sometimes in their cohorts they would put them all together. People that lived with lots of arthritis, people that had fibromyalgia, people that had migraine headaches and so forth. And they found that an intervention such as this would give people tools to mitigate their pain in their lives and reduce their suffering. Prostate cancer, showing that there was one study that showed that a mindfulness-based intervention and a plant-based diet in combination showed a reduction of PSA elevation in people who had diagnosed cancer. Significant reduction. I think it was somewhere in the realm of like 35, 40%. HIV, showing a slowing of the reduction of CD4 counts, everything else being equal in their treatment. And many others. There's studies on psoriasis, there's studies on inflammatory bowel disease, etc. So it's a very exciting place of research, and it's just exploding. And so we'd like to give you a little taste of what mindfulness is about. So in order to do this, I would ask that if you're holding onto a pen or a piece of paper or a book, that you just put it to the side for a moment. That you find a comfortable place in your chair where you can sit erect. Place your feet on the ground about hip width apart. And just begin with about 3 or 4 deep, full breaths. So just breathe in, eyes can be open or closed, whatever's comfortable for you. And just with every deep breath in, maximizing the air entering and leaving your body. Breathing in wakefulness and vitality, breathing in awareness of how you feel right here and right now. As you fully arrive right here and right now. And I'll ask you to just now allow your breath to have its own rate and rhythm. To just surrender to the wisdom of your body, to just breathe. Almost witnessing the breath as it rises and falls, expands and contracts, comes in and out of your body. And I'll invite you to bring your awareness through your body, allowing your exhalation to just carry away any residual tension. So bringing your awareness into your forehead and scalp. With each and every exhalation, just allowing your out-breath to soften in your forehead and scalp and around your eyes. With each and every out-breath, just letting go of any tension in your cheeks, in your temples, around your ears, in your jaw. With each and every exhalation, just softening and lightening around your mouth, your chin. Really with letting go, really breathing out any tension in your throat, in the front, sides, and back of your neck. And your mind might wander into fatigue, or it might wander into narrative, or storytelling, or planning, or remembering. When it does this, just notice that this is what your mind is doing. But then bring it back to your body scan, to your breath, as you release any tension in your shoulders and in your arms. With every breath out, allow it to carry any tension in your arms and in your chest and upper back. Softening and lightening in your diaphragm and middle back. In your abdomen and lower back. Releasing and softening in your pelvis and in your hips, in your thighs, in your knees, softening in your shins and calves, in your ankles, in your feet, and in your toes, until your whole body is a little bit more relaxed, a little softer, a little bit more slowed. And I'll invite you just for the next couple of minutes to just allow your awareness to anchor upon the sensation of breath in your body. Nowhere to go, nothing to be. Just witness this breath that's always here as it rises and falls of its own accord. And notice that there's a physical sensation of your breath, perhaps in your abdomen, or perhaps at your nostrils. And just as sometimes our mind is like a ship on a stormy sea, with this wave carrying it this way and this wave of emotion carrying it that way, allow your breath to be your anchor. Allow yourself to move beneath the surface of thought waves and emotions and fatigue into the depths of quiet, of healing, of peace that always exists within you. Just noticing the sensation of breath, perhaps repeating in your mind in with every in-breath and out with each out-breath. And I'll invite you to slowly deepen your breath once again. Just aware of how you feel in your mind and body at now. Maintaining your sense of relaxation and presence even as you allow your awareness to expand. Take in any sounds in the room, an awareness of your clothes against your skin, your body against the chair. Gently moving your fingers and toes. And when you're ready, opening your eyes. Thank you, everyone, for allowing me to come here and speak. I believe that Alyssa's going to leave some time for questions, if anybody has any questions for Helen, Chris, or I. And I would just offer in parting that this journey of offering mindfulness-based therapies to the patients that you've referred to the program has been an unbelievable one for me personally. You know, Chris spoke so beautifully about following your passion and your values and living from a place of strength. And there's things that happened in group medical visits focusing on mindfulness that doesn't happen very often one-on-one with the experiences that I've had as a family doctor. So I encourage you to try it out. Thanks, everyone.